The sartorius muscle is a long, thin muscle located in the anterior compartment of the thigh. It is known as the longest muscle in the human body and plays an essential role in various movements of the hip and knee. Anatomy of the sartorius muscle. The sartorius originates from the anterior superior iliac spine (ASIS), a bony prominence on the pelvis. It inserts into the pes anserinus, a common tendon shared with the gracilis and semitendinosus muscles, located on the medial aspect of the tibia, shin. Function of sartorius muscle. The sartorius muscle has several functions. Hip flexion. It assists in bending the hip joint, bringing the thigh up toward the torso. Knee flexion. It helps flex the knee joint, allowing the lower leg to move towards the buttocks. Lateral rotation of the thigh. When the hip is flexed, the sartorius also aids in rotating the thigh laterally, outward. Abduction of the thigh. It assists in moving the thigh away from the midline of the body. Movements involving the sartorius. Sitting cross-legged. The sartorius is engaged when sitting in a cross-legged position or performing similar movements, walking and running. It plays a role in the gait cycle, particularly during hip flexion and knee bending. Squatting assists in movements requiring knee flexion and hip positioning. Exercises to strengthen the sartorius. To strengthen the sartorius muscle, consider exercises such as leg raises, lying on your back and raising one leg while keeping it straight. Hip flexor stretches. Stretching the hip flexors can enhance flexibility and function. Lateral leg raises, standing or lying on your side and lifting the leg away from the body to engage the sartorius. Clinical relevance. Injury. Strain or injury to the sartorius is less common but can occur, particularly in athletes involved in sports that require rapid changes in direction or kicking. Sartorius syndrome. This is a rare condition that may involve irritation or inflammation of the sartorius muscle, often presenting as anterior thigh pain.